Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2000 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had incredible initial feedback, including ideas on how to use this VR tool as a standalone awareness event, how to create a training around it, or add it to trainings that are already being held. Just as we're starting to host in-person community awareness events, we all know what happened and we moved to virtual everything. And while we're hoping the last half this year might allow us to have more opportunity to host events back in person, we're currently hosting virtually. And we are thankful to our amazing CADCA members, and specifically today thankful to our good friends, Dr. Pam Meem and the team at Lexington One Community Coalition here in South Carolina for being our co-hosts. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers here in South Carolina who are working every day to save lives and who we are honored to be part of this event today. Then, along with the Walmart Academy team, led by Kimberly Austin, we will view a virtual reality simulation that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. We'll follow along with the Academy lead who will be experiencing this training in a VR setting while wearing the Oculus headset. Lastly, we would love your valuable input today and learn from all of you who are in attendance how you would use this virtual reality format in your communities. We plan to learn from these events how we could roll this technology out nationally and what we would need to accompany this goal. We would really love your ideas for using this tool for training and awareness purposes. So again, really would love your valuable input. After we hear from the speakers and see the simulation, we'll ask a few questions at the end of the hour. And if you could type your answers into chat, we'd appreciate your input. Additionally, in the weeks to come, we will reach out to you as a group to get more input from you as well. And now on to our speakers. First, we will start with CADCA's president and CEO and my boss, General Barry L. Price. After a decorated and distinguished 31-year career in the United States Army, General Price joined us at CADCA nearly 5 years ago as our Executive Vice President and Chief Operating Officer. Last September 1st, he was named CADCA's third ever president and CEO, and we are excited to have him as our leader. General Price is a recipient of numerous military awards and decorations, including the Distinguished Service Medal, Defense Superior Service Medal, and the Bronze Star Medal. General Price's impact on our nation's armed forces is felt to this day. General Price, thank you for your service to our nation and now your service to our communities. I turn it to you.
Thank you, Reiko, for that introduction. CADCA is excited to join our friends from South Carolina Department of Alcohol and other drug abuse services. Dr. Pamela Meem, Tanny Thomas Tedford, Brock Sansbury, and other leaders from the state of South Carolina for this training and virtual demonstration on how to save a life by reversing an opioid overdose. I would like to personally thank Walmart for their investment in not only this technology, but for their investment in people who will benefit from this life-saving training. And a special thank you to everyone on today's webinar. We hope this unique event will train you on how state and local agencies are collaborating to combat opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide, more than 5,000 across the United States, and we have 65 coalitions in the state of South Carolina. We have sought to train community residents and leaders to build and develop coalitions in their communities and reduce illicit drug use through the adaptation of CADCA's model for community change. We know that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. And prevention has become more important now than ever. Late last year, the CDC posted an important health alert advisory indicating that increases in drug overdose deaths appear to have accelerated during the COVID-19 pandemic. Recently, that number has grown to more than 90,000 overdose deaths reported in the 12-month period ending September 20. This number would be the fourth largest city in South Carolina, larger than the population of Mount Pleasant. To put that into perspective, the capacity of Clemson University's football stadium, Memorial Stadium, is 81,500. This is tragic, but not surprising news. During the COVID pandemic, many Americans are experiencing heightened stress and anxiety, as well as anxiety related to physical and social distancing. And our work to prevent substance use and misuse is more important than ever. Due to COVID distancing practices, people are not able to access their doctors or recovery or treatment sources as needed. I would like to take a minute to talk to you about our motto, One CATCA. One CATCA is a call to action. It signals that the participants within this movement must unite and come together if we are to become one. If we are to win. One team, one vision, one CATCA. Together we are stronger. And as we train substance use and misuse prevention to coalitions every day of the year, all across the world, we know that without the buy-in of local leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. As CATCA's president and CEO, I wish each of you success in your direct communities and ask you to join me in becoming one CATCA. I cannot do this without you. You are the true heroes in your community. I'm excited to be a part of this event today with our partner Walmart, who has developed a virtual reality tool to deliver a powerful experiential element to naloxone and overdose reversal trainings. It has never been more important to know how to save a life, and our coalitions are on the forefront of efforts in their communities and are making a tremendous impact. I will pass it back to you, Reiko, who will introduce Dr. Pam Meem, chairperson of the Lexington One Community Coalition. Thank you for having me today, Reiko.
Thank you, General Price. It was great to hear from you, and we appreciate your time. Now it is my pleasure to introduce you to Dr. Pam Meem. Dr. Meem is a community psychologist in Lexington, South Carolina, who works to prevent high-risk behaviors among youth. She currently serves as the chairperson of the Lexington One Community Coalition and is a longtime friend and member of CATCA. Pam will talk to us today about South Carolina's community prevention work.
Hello, thank you for joining our statewide event. My name is Pam Meem, and I serve as the chairperson of the Lexington One Community Coalition. We are a group of community stakeholders that are still going strong and meeting, even after 17 years. Our coalition is very excited to participate with CATCA and Walmart to share with you some of the new virtual training options for how all coalitions may provide educations to communities. You know, as General Price always says, community coalitions have key roles in how information and resources are shared and disseminated to our community. We all know that opioid misuse and overdose affects all of our counties. Lexington County is not immune. And the year 2020 has really set us back on some of the progress that we were making. But we still continue to be focused. We still are working on sustained prevention. And we've been able to develop some new relationships with medical partners, including EMS, and we've started some innovative strategies, even with leadership from the coroner's office. We have active recovery community organizations that are in Lexington. These are important partners for prevention, as that they can do additional strategies such as linking spouses or families to support services that they might need. As all communities work to reduce the risk of substance misuse and overdose, we recognize that there are big challenges that can sometimes seem overwhelming. Interestingly, Data has shown us that over time, there have actually been 4 distinct waves of the opioid crisis. In the early 1990s, opioid medicines were increasingly prescribed for painful conditions as well as other ailments. The use of opioids increased dramatically with a fair amount during the 1990s. The second wave is documented to be around 2009, 2010, when the use of heroin became much more common. While pills were still being used, many turned to heroin because of the fact that it was cheaper and easier to get. Around 2013, the use of fentanyl and carfentanil made the scene, and that was what is known as the third wave of the crisis. Certainly, mixing fentanyl and carfentanil with other drugs, such as cocaine and heroin, can be deadly. Today, we talk about the fourth wave. Yes, we still have opioid pills that are abused. We still have heroin and fentanyl, but the use of methamphetamine is identified as the fourth wave. Again, mixing meth with opioids is frequently a deadly combination. This is something that we see a lot in Lexington. The overdose reversal drug known as naloxone is a life-saving medicine that is widely available in our communities under the brand name Narcan. During the pandemic, you know that we saw very innovative ideas throughout South Carolina as our prevention professionals hosted drive-to events and drive-through events where people could show up to hear about naloxone, receive a brief training on the use of the drug, and then take that antidote with them. You or your agency may be a community distributor of naloxone. Let people know that you have it. Remember, it can save a life, but only when it is in the hands of those who know how to use it. Thank you. Hello, thank you for joining our state.
Thank you, Pam. Thank you so much for taking the time to be part of this event and everything you do every day for South Carolina families. Next up is Sarah Goldsby. Sarah has been the director of the South Carolina Department of Alcohol and Other Drug Abuse Services, DAODAS, since 2017, and leads South Carolina's response to the opioid crisis. Under her leadership and role as co-chair of the State Opioid Emergency Response Team, DAODAS has been instrumental in helping local law enforcement, first responders, and community distributors employ the use of the emergency overdose antidote naloxone. We'll now hear from Sarah.
Good evening. My name is Sarah Goldsby, and I'm the director at the South Carolina Department of Alcohol and Other Drug Abuse Services, or DAODAS. And I very much appreciate your attendance at this event. And we're really grateful to CADCA and Walmart for partnering to make this possible. Information about how the drug crisis is shifting and understanding how naloxone can prevent overdose death is so important. I'm going to share a little bit of our perspective on what we're seeing statewide when it comes to trends with substance use, as well as the impact that the last year had and where we think we're going. A lot of what I'll share in the next few minutes is in the form of data, but at DAODAS and across all state agencies, we know that when we talk about data, we're talking about real people, because the impact in this work is personal to so many of us and our families. Before the onset of COVID, the top problems related to substance use in South Carolina really revolved around alcohol, cannabis, opioids, stimulants, and tobacco. Overall, in 2019, there were nearly 500,000 hospital discharges across the state that were related to substance use disorders and dependence. When it comes to prescription and illicit drug use in the state, the year-over-year increase in overdose deaths had been slowing over the past 2 years, as total drug overdose deaths increased only by 3% from 2018 to 2019. This was a slower pace than the 10% national average increase, and it was a slower pace than the 10% increase we saw in South Carolina the previous year and the 14% increase prior to that. So while we were really seeing drug-related deaths level off overall, in recent years there has been actually a particularly sharp increase in deaths involving illicit fentanyl, an opioid called fentanyl. And we saw a 17% increase in fentanyl-related deaths from 2018 to 2019. We've also seen sharp increases in deaths related to psychostimulants like methamphetamine and cocaine. We actually saw a 40% increase in those stimulants from 2018 to 2019. Now, we work closely with law enforcement in a number of ways, and that includes a lot of information sharing on drug trafficking trends. And what we know is that larger amounts of very potent methamphetamine, cocaine, fentanyl, and fentanyl analogs are coming into the United States and to South Carolina, more so than ever before. We're here to talk about naloxone and the overdose reversal tonight. And though naloxone cannot reverse an overdose that's related strictly to psychostimulants, we know that many of the illicit drugs being trafficked now, they have fentanyl integrated in them, including heroin, methamphetamine, cocaine, and sometimes even marijuana. So there can be a risk of opioid overdose when any of these substances are used. Additionally, COVID-19 and circumstances in 2020 have had a big impact on substance use disorders in our state. For many of us, the pandemic has been associated with significant levels of psychological distress linked to anxiety, fear, isolation, and economic loss. And because people typically drink or use substances to alleviate negative feelings or to simply feel good, we did see these factors exacerbate alcohol and other drug issues during 2020. When it comes to overdoses, South Carolina was hit hard like all other states. Suspected overdoses with EMS response were already slightly higher than 2019 at the start of the year, but that gap widened in March during the COVID-19 pandemic. And in May of 2020, we saw the highest month in state's history in terms of incidents of suspected overdoses occurring. While the climb flattened later in the year, overdose incidents have remained elevated. Suspected opioid overdoses reported by EMS were around 40 to 50% higher in South Carolina last year, 2020, than they were in 2019. Overdose incidents continue to remain elevated into 2021, with suspected overdoses in March of this year estimated 17% higher than March of 2020. Now, the law enforcement officer naloxone and firefighters reducing opioid loss of life are LEON and ROLL programs, where those trained first responders administer naloxone ahead of an ambulance arrival. Those programs have also had a record year. Last year, there were 752 law enforcement and 273 fire department naloxone administrations reported. That's big increases over 2019. Naloxone administrations for those programs have remained extremely high into 2021. And finally, provisional mortality data from the CDC predicts 1,625 South Carolinians died from drug overdose between September 2019 and September 2020. That's a 45% increase over the same period the year before. Illicitly made synthetic opioids, which can include fentanyl, are largely responsible for this increase, with over 62% of those predicted overdose deaths estimated to involve synthetic opioids. We'll know more when final overdose fatality data for 2020 is reported by DHEC later this year. But when it comes to acting on this ever-evolving drug crisis, one of the most important things we can do is to keep those at risk of overdose alive. Recovery from opioid use disorder and substance use disorders is real, and it's possible for everyone, but only if they are breathing. Naloxone is effective. It's available in South Carolina, and it should be accessible to anyone who needs it. The 1,625 South Carolinians we lost to overdose last year were our neighbors, friends, family members, and each of them died a preventable death. So again, I'm truly grateful for your attention this evening, and I hope that you will call us at DAODAS for any assistance or information about services and the possibility of recovery. Thanks.
Thank you to Sarah for all those remarks, that amazing, really impactful data, and for helping us all to better understand some of the challenges and the really impactful work that you all are doing in South Carolina. It is now a pleasure to introduce CATCA's longtime friend, Michelle Nienhuis. Michelle serves the state of South Carolina as Prevention and Intervention Manager for DAODAS. This position includes planning and implementing statewide programs in the field of substance abuse prevention, as well as overseeing several state and federal grants awarded to South Carolina for substance abuse, including the primary prevention set aside from the Substance Abuse Prevention Treatment Block Grant. Turn it to you, Michelle.
Good evening. My name is Michelle Nienhuis with the South Carolina Department of Alcohol and Other Drug Abuse Services. Thanks for joining us this evening. I'm going to go over a little bit of information on our overdose awareness campaign, justplainkillers.com, as well as information concerning Narcan and Narcan distribution in the state of South Carolina. The Just Plain Killers campaign was started just a few years ago, and some of the highlights of the campaign and information and resources available through the campaign on the website you saw on the previous slide concern information around storing medications safely, safe disposal of medications, proper identification of your medications, making sure you have conversations with your professionals, your medical professionals about opioid use, and of course, keeping Narcan available on hand in case of an overdose. There are several tabs on the website. The tabs are related back to these primary topics of pain management and having those conversations with medical professionals. So you can find all sorts of resources under that tab. Under the drug safety tab, that's where you have an interactive map where you can search all of the permanent drop box locations in the state where medication can be safely disposed. Tips on safe storage are also found on that tab. We have all of the overdose and opioid related data on our Just Plain Killers site as well for the entire state. There are fact sheets previous years and just being able to see the trend data under that opioid data tab. There's also an overdose prevention tab, and this is the tab I'm going to concentrate on the most in the presentation this evening. And on the overdose prevention tab, there's going to be information on what is Narcan, where is it available, and how to use it. And finally, we have a tab on finding help because certainly we want to highlight the resources for treatment and recovery that are available all throughout the state as well. So please take a moment when you have a chance to visit this website. So I'm going to talk a little bit about the importance of the laws we have in South Carolina as it relates to reversing an overdose. So in South Carolina, there are a few different laws that have passed over the last couple of years to give us the infrastructure to be able to provide Narcan throughout the state for first responders and lay people to respond to overdoses. The first one is the Good Samaritan Law. And the Good Samaritan Law primarily protects a person who is in good faith trying to render care, and it protects them from civil liability. Many states have this type of law. We also have a specific law in South Carolina called the Overdose Prevention Act. And the Overdose Prevention Act similarly also protects the caregiver who administers Narcan to a person whom the caregiver believes in good faith is experiencing an opioid overdose, and that protects them from civil and criminal liability. This South Carolina Overdose Prevention Act does protect both lay responders and first responders. Then in 2018, in the legislative session, the law was amended again to ensure that we could have community distributors set up throughout the state to be able to house and provide naloxone in large quantities throughout the state for agencies to be able to dispense that medication with that non-patient prescription following that joint protocol. The community distributors part of the Overdose Prevention Act allows the community distributor organization to have a standing order from a physician for that organization, and then that organization is able to acquire the naloxone and then provide it to individuals in the community without it having to be patient specific. In South Carolina, we have a way in which organizations can become community distributors. They apply through the state, and our definition of community distributor is an organization, public or private, that provides substance use disorder assistance and services such as counseling, homeless services, advocacy, harm reduction, alcohol and drug screening and treatment to individuals at risk of experiencing an opioid overdose. So the statute was written very broadly to allow different kinds of organizations to apply and become community distributors. If you're interested in becoming a distributor, please visit our website at daodas.sc.gov, and there is a fact sheet on the front page of the website that walks you through the process of becoming a community distributor. So the community distributors are providing Narcan throughout the state, and Narcan is obviously the medication that can be used to reverse an opioid overdose. As I stated before, it can be provided in South Carolina without a prescription, both through our community distributors and through pharmacies in the state. And pharmacies throughout the state typically carry Narcan that is either covered by folks' insurance plans and or Medicaid. We also have two programs in our state specifically for first responders. These two programs were established under a SAMHSA grant of the Preventing Drug Overdose Deaths grant, and we received that grant back in 2016. The first program that we established was the Law Enforcement Officer Narcan Program, or the LEON program. And the goal of that program was to really try to provide as much training and support for our law enforcement agencies and those officers to be able to carry Narcan and administer it in the case of an overdose. Since 2016, our state has trained almost 11,000 law enforcement officers from 216 agencies, and we are continuing to train more and more officers every day. A second program that we established under this grant in 2018 is directly related to our first responders from fire departments. And this is the ROLL program, the Reducing Opioid Loss of Life program. Here again, it's to equip our firefighters with the ability to know how to use and recognize the signs and symptoms of an overdose and respond to an overdose by administering Narcan and providing that emergency care until other first responders such as EMS arrive. Since 2018, we have trained almost 2,000 firefighters throughout the state to utilize and administer Narcan, and those firefighters have represented around 113 fire departments in our state. And we are continuing to build these programs and continuing to train as we speak. It's continuously happening all throughout the state. So these types of programs, the community distribution program that gets Narcan out to patients, caregivers, and lay first responders to be able to administer that Narcan in the case of an overdose, along with the law enforcement and the firefighter program, LEON and ROLL, are extremely crucial to the life-saving medication being available all throughout the state. And in addition to these programs, we wanted to ensure that we provided a public awareness message about Narcan. And so we created a campaign that's a spinoff of the Just Plain Killers campaign, and it's the 1, 2, Breathe campaign. This campaign is really looking at ensuring that education is provided all throughout the state on the accessibility of Narcan through the community distributors, the accessibility of Narcan through pharmacies, the accessibility of Narcan to our first responders, and ensuring that people understand what it is, how to use it, and how they can save a life. So let's take a look at that brief PSA from the 1, 2, Breathe campaign.
How to reverse an opioid overdose. Visit a local pharmacy. Keep Narcan nearby. Call 911 and administer. Save a life in 1, 2, Breathe.
Good evening.
Thank you, Michelle, for your tremendous work in South Carolina and your friendship with us at CADCA. Next up, we will hear a few words from Tani Thomas Tedford, who is the Assistant Chief at the Public Information and Relations Bureau at Lexington County Emergency Medical Services. Lexington County EMS was first organized in 1974 with 16 employees working 24-hour shifts with a total of 4 ambulances. Today, the service employs over 150 full and part-time employees working 12-hour shifts on up to 18 ambulances and answering nearly 50,000 calls per year. Tani will talk to us today about naloxone administration and EMS teams.
Well, hello. My full name, Tanny Thomas Tedford. I am a paramedic for Lexington County EMS here in South Carolina. My official title is Assistant Chief of the Peer Bureau, PIER, and that stands for Public Information Education and Relations Bureau. I've been with the county going on 15 years, and the first 12, I was on the road, 2 years as an EMT, and then 10 years as a paramedic on an ambulance. So as a paramedic, 12 years, goodness gracious, alcohol abuse, misuse, drugs, those are definitely calls that stick out. Running overdose calls has been a challenge for me. I am as well suffer from substance abuse, misuse. Drugs and alcohol are a huge part of my story. They are a part of who I am, but I'm no longer currently drinking or using illegal drugs. Narcan has been a huge game changer with our overdoses. Narcan is a part of several of our standing orders of our recipe book, if you will, for paramedicine. We use it for a lot of different things to cover different bases, but when it's a suspected opioid overdose and we're administering Narcan, there's several ways that we can give it. IN in the nose, IM in the muscle, IO through a bone, IV through an IV. And there's been the effect, if it is an opioid overdose, is fast. Giving Narcan is relatively easy, especially if it's given up the nose, IN intranasally. And one thing to be cautious of that we've probably all learned one time or another is if you give too much too quick and they come out of it rather quickly, they are usually very upset because you have bad their high, you've taken away what they worked so hard to get. And then also throwing up and then withdrawals. And so that's a big deal, but that's more with a larger amount given in ways that bystanders, the layperson can't do. With overdoses, excuse me, because I have a history of drugs and alcohol, one would think that maybe I would be extra compassionate with overdoses, and I wasn't. I found that I wasn't. When I would go on overdose calls, my heart would change. There was more empathy and sympathy for the kids, for the family members that were around the individual that was unresponsive, and the sadness that comes with addiction and how it can tear apart a family. One individual sticks out in mind where he has at the time a 12, 13-year-old daughter, and by second or third time we were there, within months of each other, she knew what dad did. She knew where the medicines were. I would just ask her to go get what I needed to, as we were giving the Narcan initially. First you give it IN, and then when you get vascular access, you can give a second dose if you need it. And just the sadness of the innocence lost with her, that was unfortunate. So yay, we have Narcan. We give it properly. They wake up, they go to the hospital, they leave. We see them again. It is a solution. It's a part of a solution. So what next? What more can we do? We have, Lexington County EMS, have had the absolute honor of working with a recovery center. They're called the Courage Center. When we've administered Narcan for a suspected opioid overdose, they get a pouch with a cell phone, a very inexpensive flip cell phone with a few minutes on it, a designated amount of minutes on it, with a text when they open it up, that talks about the Courage Center and they're worth help and dial this number to get help. On the other end of the phone is a certified recovery coach. So these individuals, our staff will adhere with a carabiner, the pouch onto them. They can call, yeah, I just had an overdose and can you help me type of a deal. The number is there, the texts are there. Recovery coaches call 3 times. And then myself and my partner, Austin Pace, and a recovery coach from the Courage Center, we can go out and talk with them and meet with them. So that's one more step. Is that the answer? No. Is there way more we could be doing as a community, as an individual? Absolutely. Yes, but it's a start, right? It's a piggybacking off of the Narcan. One of my coworkers was telling me a story where he gave Narcan to an individual. He was going to adhere the pouch onto their belt loop. And when they came to, his approach was, hey, man, it's good to see you. I'm glad to see you. When he opened his eyes and he heard, it's good to see you. You matter. The paramedic said he saw it in his eyes that the patient mattered. And don't we all want a purpose? Don't we all want to feel loved and mattered? And that we're not invisible and that we have a voice. And so how collectively as a community whose responsibility it is, because we know better, how do we give a voice to those who haven't found theirs yet? Thank you all for everything that you're doing and for everybody that's involved in this amazing project. And just continue the fight. And if you can be anything, be kind.
Thank you, Tanny, and thank you to the entire Lexington County EMS team for all that you do. And now we'll hear from Brock Sansbury. Brock is Deputy Director at the Courage Center in Lexington. The Courage Center provides a safe, supported, recovery-focused setting for young people and families on their journey to recovery from substance misuse or substance use disorder. Brock will talk with us about helping to reduce the stigma associated with substance misuse.
Well, first and foremost, I want to thank everyone for being here. My name is Brock Sansbury, and the first thing that I have to tell you about myself is that I am a person in long-term recovery and have been since October 24th of 2013. I would assume that most of you understand that means I don't find it necessary to take a drink or a drug or any mood or mind-altering substances. And since then, my life has changed in dramatic ways. First and foremost, I'm a son, I'm a grandson, I'm an employer, I'm a friend, I'm a member of the recovery community in good standing, I think, most days. And I'm a neighbor, right? I have kids on my street now that come and knock on my door and want to hang out with me and my dog. And people call me when they want advice, and people kind of trust me now. And those things weren't the same like that. Things weren't like that for me about, almost 8 years ago. Things were dramatically different. My life was incredibly dark and full of despair and debauchery and self-centeredness and selfishness, and really just kind of thinking that I ran the show all the time, day in and day out. And I mean, let's be honest too, recovery doesn't mean that I don't try and do that in my life today. It's actually one of the things I don't like about perception of people in recovery, that we're these mystical creatures that never make mistakes, aren't wrong, their ego doesn't get in the way. Their life just seemingly just flows into the abyss of unicorns and rainbows, and that's just not the case. At the end of the day, recovery from addiction gave me a chance to be a participant, an active participant in my life, right, wrong, or indifferent, and I'm incredibly grateful for that. When I decided to make a decision to change my life, I had no idea where that would lead me, and it's brought me on along a journey that I used to dream about, sitting in my house alone, afraid, searching for friends in dope houses and bar stools, for a lack of better words, and come to find out that all those friends were in these little buildings that I never ever wanted to go into, right next door. And since then, I've gone back to college and got a college education from University of South Carolina. I'm in the process of getting my master's degree from Clemson University. My family enjoys having me around now. Relationships are a lot stronger than they've ever been. I have a career that I'm incredibly proud of, and several people I have to thank for that. You know, Dr. M, Adrian Bellinger, Julie Cole, who really brought me into this world, Sarah Goldsby, and Sean mentioned some other folks too. I mean, all those people have been incredibly influential into how I got here today. And in my world at the Courage Center in terms of recovery support services, and really the lack of what that service even is in terms of peer support and mutual aid and recovery coaching is, we all understand the darkness and despair that addiction brings. Anyone can say the word addiction, and we all understand what that is, right? When we say the word recovery, I've said that to a person and they've said, well, what surgery did you have? So again, the perception and the education is still very much needed in that world. And it really starts with people sharing their experience, strength, and hope, right? Putting a face and a voice to recovery. When people look at me, whether it be from socioeconomic standing, ethnicity, sexual orientation, whatever, they look at me and they don't think I used to smoke crack cocaine and was an IV drug user. I don't know why. And so again, having the opportunity, and I'm so grateful to A, be alive, and B, being able to have the platform to constantly put my story out there, but not for myself, but for others who are too scared to do that, because that's the deal, is people don't have the opportunity to speak out. They don't have the opportunity to connect to recovery services, to treatment services, to sober living houses, to detoxification centers. And again, and I think that all comes back to the stigma of what we're dealing with. But overdoses are real. People are dropping left and right. I love this initiative with the VR thing that Walmart has done. Forgive me for not knowing the exact name, but I mean, what a great opportunity to put yourself in someone else's shoes, right? And my goal is to never make anyone walk in my shoes, but stand next to mine, and so I think with bringing and having that awareness from such a macro level and such a large corporation like Walmart, who has, touched every corner of the world pretty much, I think that says a lot to their character and the integrity they have as a company, that they want to bring this to light. And I appreciate them for that, because it's very important. Naloxone saves lives. This initiative could save a lot of lives. And I think at the end of the day, regardless if you agree with naloxone or medical assisted treatment, at the end of the day, you have to ask yourself, what's a human life worth? And I think we'd all agree that human lives are worth everything. And so I hope that kind of displaces some of the ifs, ands, or buts about what this kind of treatment can do for individuals. So I appreciate you having me. It's an honor, and looking forward to the future. Thanks.
Thank you so much, Brock, for taking the time to talk with us today and for being willing to share your story with us and discuss how important and impactful our work is. So now I am going to pass it to our very helpful partner, Kimberly Austin, and the team here at the Walmart Academy, who will walk us through the virtual reality simulation. The Academy team will wear the headset and allow us all to experience the virtual reality demonstration along with them. Kim?
Thank you, Reiko. Good evening, everyone. I am the Senior Manager supporting Academy 1130 here in Lawrence, South Carolina. And we are so excited to show you this very important virtual reality simulation. About 5 years ago, Walmart made a commitment to our associates, which included a greater investment in training. In that time, we built over 200 academies and developed new tools to help train our associates. That includes using virtual reality, initially developed to recreate those situations that aren't easily replicated in the classroom or special events such as Black Friday. We also thought about how can we make a bigger impact in the community. We began to consider how we can share these spaces and these tools with the communities that we live and work in. Our Academy team worked with a number of experts, including CADCA, on the development and launch of this program, which shows the proper use of Narcan. We hope that this simulation can help save lives. So at this time, I will turn it over to Venus and Travis to show you our VR demonstration. Thank you.
Guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey, you okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's your emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh, no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. To shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone.
So what's the first thing you do to administer naloxone? Shake the device vigorously, clear the patient's nose, or peel back the packaging.
Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise.
So what's the second step to administering naloxone? Thumb on the nozzle, remove the cap from the device, or thumb on the plunger.
Correct. That's how you hold the device.
What is the last step when administering naloxone? Insert device into nostril, insert device under tongue, push the plunger to administer.
That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Academy team for helping us with the demonstration today. And thank you so much to Walmart for hosting us, and to all of the speakers here today who've taken time out to be part of this event. We really wanted to get to some Q&A because we really want your feedback. You all have just such amazing suggestions for how to use this VR technology. But we had just such tremendous content that we really used most of this hour. So I really am going to keep it to 2 questions and follow up with everyone afterwards to really just learn more about your feedback. If you can really type your answers into chat, that would be great. And then we will let you go on your way. But our first question is, if you have suggestions, how would you best use this VR simulation and technology in your community? Build a training around it, add it to trainings that you already have, and who would need that? And I have here, I'm excited to partner on this project. I have a few community partners. Actually, I'm going on here. Okay. Does Narcan reverse the effects of only Schedule II drugs? Okay. So I think we can definitely follow up with you and get you all of that information. All right, I know that we all want to go. So the second question that I have is, if you could think about this, is really, what are sort of the areas in your community where maybe people can use training and they aren't getting it, or can use naloxone and they aren't getting it? And I know that there were Volunteer fire departments were ones, health classes, high school, small businesses, casinos. We believe this is an all-staff community education course. It would be nice to have a refresher course as well. That is a great suggestion. We just partnered with our library system, and this would be a great way to reach the community. I love that. I would love to use it in the correctional facilities with residents who are about to be released. Great idea. We're starting a Narcan program. We'll be able to supply them with the medication prior to that release. Thank you for that. Okay, a lot of chat. Linda, thank you. Okay. So we absolutely will be following up with everybody and really learning about everything that you all have to say. You all have such tremendous feedback. We are through the hour. We want to extend our thanks to all of our speakers and participants for attending this event. We really and truly appreciate your time and your insight. Please reach out to us at CADCA anytime with more suggestions and questions, and look for us to be reaching out to you to discuss this more and get your tremendous feedback. We want to conclude the evening. We appreciate your time. We hope you have a wonderful, long and restful weekend. I know we all take some time to remember and appreciate all of the people who've served and currently served our beautiful country. Thank you all again, and have a great night.